Alright, hello everyone. I'm Dr. Tushar Mehta. I'm an orthopedic surgeon and national level faculty of orthopedics for PG aspirants as well as for the PG residents. This is a very small video. I'll give you a brief before I start the video. This video is about a common question which is asked, of course, by the PG aspirants, and at times I've seen it, being asked by the PG residents also, those who are into their MS, DNB or Diploma Orthopedics. Question is very simple. They ask me a question that, sir, in supracondylar fracture humerus, which is a very common pediatric fracture to happen around the elbow, I'm sure all of you are aware of it. They ask me a question that, sir, in this fracture we have a question that which is the most common nerve injury? That's the first question which is asked. I have seen this question a couple of days ago. Somebody was asking on social media also, so I thought I'll answer it with the help of a video. So it is a very clear-cut question with a very clear-cut answer that the most common nerve injury in this particular fracture is anterior introitious nerve, which is a motor branch of median nerve. So that is the most common nerve injury. Now, I'm sure all of you are aware of the fact that in this fracture supracondylar humerus, the most common displacement is posteromedial. So the most common displacement is posteromedial followed by posterolateral. So this is a common question, that most common displacement is posteromedial followed by posterolateral, and then when we talk about the nerve injury, then the most common nerve injury is anterior introitious nerve. Now there is one more thing that I want all of you to remember is this, that when we talk about the most common nerve injury in individual displacements, let us say when we talk about the most common nerve injury in posteromedial displacement, it is radial nerve. But when we talk about the most common nerve injury in posterolateral displacement, it is anterior introitious nerve, which is a motor branch of median. Now comes the first question. Sir, yes, tell me. Sir, you told us that most common displacement is posteromedial. Yes, I told you. Then you also told us that in posteromedial displacement, the most common nerve injury is radial nerve. Yes, I told you. Sir, then if you told us that the most common displacement is posteromedial and in the posteromedial displacement, most common nerve injury is radial nerve, then why the hell are you saying that overall most common nerve injury is anterior introitious nerve? Sir, I want the answer to this question. I do hope that all of you have understood the question at least. That most common displacement is posteromedial, agreed. Most common nerve injury in posteromedial displacement is radial nerve, agreed. Then why the hell overall most common nerve injury is anterior introitious nerve? Sir, I want an answer. I will give you the answer with the help of a hypothetical kind of a figure that I'm going to share with you. Let us assume that 10 patients are there of supracondylar fracture humerus. Let's first assume it. Out of these 10, let us assume, although I'm giving you a statistical answer, but it is a fact-based answer. 6 have posteromedial displacement, 4 have posterolateral displacement. 6 have posteromedial displacement, 4 have posterolateral displacement. So that makes it very clear and obvious that posteromedial displacement is more common than posterolateral displacement, but of course we know that. Now, don't you think as an orthopedic surgeon I need to treat all these 10 cases? Say yes or no? Yes. During the treatment part, whether any complication happens or not, that is the job of an orthopedic surgeon, yes or no? Yes. So what I see is 6 never developed any sort of a nerve injury, while 4 develop one or the other nerve injury. Now those 4 which developed one or the other nerve injury, I could see that 3 were having posterolateral 3 were having posteromedial displacement and 1 was having posterolateral displacement. You understood my point? So I could clearly see this. Now what I'm trying to tell you here is, just listen to me very carefully. It is a fact, you have to understand. It is a fact. I'm sorry, I mentioned it wrong. It is a fact that it is, just hold on. It is a fact that posteromedial displacement is more commonly seen as compared to posterolateral displacement. Yes, it is a fact. But it is also a fact that a posterolaterally displaced fracture will complicate into nerve injury more common as compared to a posteromedially displaced fracture. So I give you a kind of an example with the help of this, that this is posteromedial displacement, this is posterolateral displacement. So it's a fact that posteromedial displacement is more common than posterolateral displacement, but this posterolateral displacement will complicate more into nerve injury as compared to posteromedial displacement. Okay, so we have understood this, that as a displacement, PM is more than PL. Agreed. But a PL displaced fracture will complicate into nerve injury more common as compared to a PM displaced fracture. So overall, most common nerve injury which has been seen with this fracture has traditionally been with which displacement? Posterolateral. And what is that displacement? What is that nerve injury? So that is anterior introitious nerve injury. So that is why, even though, listen to me, that is why even though posteromedial displacement is more common than posterolateral displacement, but still the posterolateral displacement creating anterior introitious nerve is more commonly seen as compared to radial nerve injury seen with posteromedial displacement. And does that make sense to you? So is this first question answered, everyone? Now, it's not over. Second question. Sir, tell me. Sir, when you taught us the fracture, you told us that displacement depends upon the distal fragment. I totally remember I told you. I totally remember that I told you that whenever we talk about a fracture, the displacement depends upon the distal fragment. It is absolutely a fact that the displacement depends upon the distal fragment. So everything has to go accordingly. But this is for the displacement, not for the nerve injury. When we talk about the nerve injury or even the arterial injury, that occurs not because of the displacement of the distal fragment. Distal fragment has no role. So which fragment has a role as far as neurovascular injuries are concerned? It is the proximal fragment. So now just think of the fact that if you are talking about a posterolateral displacement, beta, in posterolateral displacement, this displacement is a what? Distal fragment. So in this displacement, your proximal fragment should go into what? Your proximal fragment should go anteromedially. And what lies anteromedially? What lies anteromedially? Median nerve. Now if I talk about posteromedial displacement, okay, now in posteromedial displacement, this displacement posteromedial is of which fragment? Distal fragment. So what is going to happen to the proximal fragment? The proximal fragment is going to go in which direction? Anterolaterally. Alright, it is going to go anterolaterally. आपको मेरी बात समझ में आ रही है? So in posteromedial displacement, it is going to go anterolaterally. And what lies anterolaterally? I hope you remember. Radial nerve making a loop and coming from posterior to anterior via lateral direction. So that is why radial. So we have come to the conclusion that when we talk about displacement, it is due to distal fragment. When we talk about the neurovascular injury, it is due to proximal fragment. And that is why in a posterolateral displacement, the posterolateral displacement is not going to give anterior introitious nerve injury. That nerve injury will be given due to the anteromedially displaced distal fragment. And similarly for the other fracture also. समझ में आ गया? Is that clear to you? So guys, till now I have answered your two questions. The first question was that even though posteromedial displacement is more commonly seen as compared to posterolateral, then why anterior introitious nerve is more common? Because that is seen with posterolateral displacement. So I told you this thing, that PM displacement is more common than PL, but a PL displaced fracture will present with nerve injury more common as compared to PM displaced fracture. Your second question was that in a PL displacement, in a posterolateral displaced fracture, why do you say anterior introitious nerve injury? Because their side we have radial nerve injury. So I told you that in posterolateral displacement, distal fragment goes posterolaterally, but that doesn't matter. What matters is proximal fragment, which goes anteromedially. So displacement, if it is due to the distal fragment, I agree, but the neurovascular injury is due to the direction of the proximal fragment. Now, Now comes the third question, the last question for this video. That sir, you told us that in posterolateral displacement, it is the anterior atrocious nerve which is more commonly injured. I agree. Sir, the fracture is somewhere here. The fracture is this proximal to elbow. Listen to me, everyone. The fracture is proximal to elbow. Yes. And sir, we have read in our first year anatomy that this anterior atrocious nerve basically arises distal to elbow. Oh, yes. Sir, if the fracture is proximal to elbow and the nerve is bloody getting originated distal to elbow, then how the hell that fracture can create this? I'll tell you, don't worry. See, better you have to understand that when we talk about median nerve and when we say that, okay, median nerve is, crossing the elbow, like at this moment, median nerve has certain anterior interosseous nerve fascicles which are basically in the dorsal part of the nerve. So this is a fact that I want all my students to know. I totally understand and I totally agree with all of you that median nerve gives rise to anterior atrocious nerve distal to elbow. And that too, when median nerve pierces the two heads of the pronator arteries, the humeral and the ulnar head, and then anterior atrocious nerve, gets originated from there. I agree. But I also want all of you to understand that even before the origin of anterior atrocious nerve, whatever median nerve that you have, its dorsal part has got certain AIN fascicle. That's the first thing that I want you to know. The second thing that I want you to know is this, that this origin, I'm sure you all can see the origin of the anterior atrocious nerve. This is somewhere around 44 to 45 centimeter from the intercondylar line of the humerus. So this origin is somewhere around 44 to 45 millimeter, that is 4 to 5 centimeter from the intercondylar line of the humerus. Itna distal aake anterior atrocious nerve starts. Now what happens is that from the point of origin to the anterior atrocious nerve, before entering into the anterior atrocious space, we have a zone 1. And after entering into the anterior atrocious space, just beneath the anterior atrocious membrane, between the radius and ulna, I will call it as zone 2. I will call it as zone 2. मेरी बात समझ गए आप? So let us say from here you have anterior atrocious nerve. From here to here, that is the, before entering into the anterior atrocious space, we have zone 1. And from entering into the anterior atrocious space, then actually between the anterior atrocious space, radius on one side, ulna on other side, anterior atrocious membrane on the above aspect. This is what I will call as zone 2. Now, why I have given you zone 1 and zone 2? Because I want you to understand that zone 2 is relatively a fixed zone. This is relatively a fixed zone. It is so fixed and nerve is very straight and fixed here. But here nerve is a little flexible. And, that is certain flexibility is there. Now, why I'm teaching you this? Because first thing that I want you to understand is, see, you have a question that anterior atrocious nerve originates distal to elbow, then why the hell a fracture proximal to elbow can lead to its injury? My first answer is that I have already told you that even before the origin of the anterior atrocious nerve, the median nerve carries certain AIN fascicles in its dorsal part, and whenever that fracture happens, whenever that proximal fragment goes and hits the nerve, there is a direct contusion of these fascicles. There is a direct contusion of these AIN fascicles in the dorsal part of the median nerve because of the proximal fragment of the fracture. So that's one thing. Second thing is sometimes, of course, this happens, but second thing is that it leads to kind of a traction. In Hindi we call it kheenchna. It leads to a kind of a traction injury onto the median nerve, and that traction injury on the median nerve gets carried onto the origin of the anterior atrocious nerve, particularly in zone 1, because zone 1 has a very less tendency to withstand those stretching forces, and therefore it gets injured. मेरी बात समझ गए आप? I agree, fracture is happening proximal to elbow, but I've told you in anatomy that part of the median nerve which is proximal to the elbow carries some AIN fascicle in its dorsal part which get direct contusion because of the proximal fragment banging onto them. One more thing that happens is not only the direct contusion happens, but there is a kind of a pulling or a traction injury that happens onto the median nerve, which is carried onto the origin of the anterior interosseous nerve, and particularly in the zone 1, that is from the origin of the anterior interosseous nerve till the time it enters into the anterior interosseous space, because the nerve is quite flexible, I've told you. So that also gets sort of a traction injury, and because of which you see the nerve injury. So my dear students, I hope you have understood what I'm trying to teach you here. So I have told you basically answers to 3 questions. Number 1, that even though posteromedial displacement is more common than posterolateral, still the posterolaterally displaced fracture will complicate into nerve injury, that is anterior interosseous nerve, more than the posteromedial displaced fracture. Second thing that I've taught you is that when we talk about displacement, we catch hold of the distal fragment. When we talk about neurovascular injury, we catch hold of the proximal fragment, so that's important. The third point that we have understood is that why a fracture proximal to elbow can lead to an injury of a nerve which arises distal to elbow. So these 3 very important questions are answered in this video, and I do hope that you make the maximum benefit out of it. So stay tuned, more videos will be available very soon. Already there's a complete residency course of theory as well as practicals and instruments. All videos have already been uploaded. Many are in process also, so you can log on to www.drtusharmehta.com, that is drtusharmehta.com, and you can subscribe to the video section. All the PG residents, the diploma, the DNB and the MS candidates are going to get benefited out of it. Thank you so much. Have a great day. Bye bye.